Now, when we're trying to understand risk in men who we think may have prostate cancer, it's very important we get the statistics right. And this means not only developing very good, robust statistical models, but it also means using high quality data. Our models are only as good as the data that we put into them. So what we're planning to do with ReIMAGINE is we're going to recruit 1,000 men who have a suspicion of maybe harbouring prostate cancer. And we're going to measure a whole range of things in those men, taken from their blood samples, their urine, their magnetic resonance images. And we're going to put all of those into a database on a computer, and then we're going to link those with the biopsies in those men to see whether they truly are having prostate cancer and how advanced that prostate cancer is at that point of diagnosis. And the reason why we need to do that is we want to understand risk at the point of diagnosis. We don't want to just identify prostate cancer and treat everybody, because some men just won't need any treatments. So we want to understand this risk better, and to do that we need good data. And what we hope this will enable us to do at the end of the study is that when new men come to clinics with a suspicion of prostate cancer, we'll be able to understand their risks better and decide which men need aggressive treatments, which men don't need any treatments at all, and which men we can discharge and safely say, you're okay, come back in a few years if you get more symptoms, etc., etc. And we're hoping that this is going to help how men are treated in the future.
Now, you may know that cancer research has changed significantly in recent decades for two main reasons. The first is we can now collect data on individual patients at an unprecedented scale. These include genomic data, imaging data, and so on. The second reason is that we have developed many new treatments for cancer, but we find increasingly that they tend to benefit only a subset of the patients and only for limited time windows. And one would ideally like to predict which patient will respond to which treatment best. Now, to achieve what we call personalized medicine, which is this tailoring of treatments to the characteristics of individuals that we can these days measure, it is very important that we develop new mathematical and statistical tools, because the conventional tools of medicine, the statistical tools of medicine, have not kept pace with the experimental advances. And this is what my group seeks to do. In ReIMAGINE, we will apply these most recent methods, statistical, computational, and mathematical methods, to the data that are generated within ReIMAGINE on prostate cancer. And we will try to generate optimal predictions on which patients will respond to which treatments optimally.